Drug-resistant TB is a really difficult problem. It's one that we've been hearing here in Barcelona is a looming problem globally. You two have been absolutely intimately involved with it because you, Jennifer, you've got a job actually treating it, and you, Busi, you had it. You had drug-resistant TB. Please, can you tell me about your experience, first of all, as a patient? What was it like?
My story started in 2005 when I was expecting that I was pregnant. I went to the clinic to do the pregnancy test, but I was offered an HIV test which came up positive. And then I went privately to do the pregnancy test, which also comes up positive. And then I started to get sick there. So I was like coughing and then losing weight. I went back to the clinic. And then unfortunately, I couldn't produce the sputum because my chest was dry. And then I couldn't do the chest x-ray because I was pregnant. But anyway, I was given the antibiotics, which they didn't help because I was getting worse and worse day by day. And then unfortunately or fortunately, I decided to go back to the clinic, and then I just suggested to the doctor that I must sign a form so that I can do the x-ray, so that I must know what exactly is going on with me. Then it's whereby like really I went to do the chest x-ray, and then finally I did produce the sputum with the suggestion of the clinician, and then I did send the sputum to the clinic, which came back like saying that I've got TB. So for me, just because it was my first episode to have TB, and then I was treated for sensitive TB. In short, in December 2005, I delivered my baby, and then after delivering, I thought that I was going to be better, but unfortunately, I was getting worse. So by then, I was on TB treatment and ARVs. So by January, I was expecting that I was going to be discharged on a drug-sensitive TB, but unfortunately, the news came back saying that I've got drug-resistant TB. So it was, for me, it was a new thing because I didn't know anything about drug-resistant TB. I was not counseled about drug-resistant TB, so they just only told me that I have to be admitted in hospital so that I can start the treatment. Because by then, the treatment, it was a matter of must that you must start the treatment in hospital.
Sounds a really difficult challenge. Jennifer, what did the teams make of that?
Yeah, so I think with Busi's story, it really highlights to us how difficult it was at that time to diagnose drug-resistant TB quickly and get people onto treatment quickly. What we've shown in Kailicha is that since Busi was cured of drug-resistant TB, we've managed to decentralize treatment. So that means patients are able to go to their local primary healthcare clinic at the same place that they would get normal TB treatment in order to access drug-resistant TB treatment, which has greatly increased the number of patients we can offer treatment to, and also reduce the time to treatment initiation.
But at the moment, you're one of the lucky ones in a way, or one of the patients who did all the right things, because you're only 1 in 5 have a positive outcome for this. What do you both make of that?
Yeah, so MDR treatment outcomes are really abysmal. Less than half of our patients who start on treatments are actually cured, and with XDR-TB it's even worse. Hey, Busi, so less than 20% of our patients are cured, and so it's really difficult, and it really highlights the need for better treatment, better drugs in better regimens, and also what we find really important is supporting patients through their treatments, and that's really where Busi comes in.
What was it like taking these drugs? I mean, what kind of difficulties were there?
It was not easy for me really, because this treatment is having severe side effects, sometimes like permanent hearing loss, dizziness, vomiting. Like, fortunately for me, my child was also like affected with drug-resistant TB, and she started the same treatment when she was 5 months old. By then, she was also like experiencing the side effects. She was vomiting. It was not easy really for me.
And we don't have drugs for children to take. So Busi's the same drugs that Busi was having to take. She was having to crush them and give them to her child, who, you know, obviously can't think, oh, I need to swallow these and keep them down. She was obviously also vomiting the meds like Busi was.
You look in great health right now. Have you got a good message to give other patients about this? Presumably there are some ongoing difficulties.
It is because really, firstly, I think to cure this drug-resistant TB is not depending on the treatment. It's really depending on the support. If we can like support our patients having the drug-resistant TB, I think we can really win this battle.
From a patient's point of view, what do you think is the top priority for improving therapy and the general support for patients with drug-resistant TB?
Firstly, they must be treatment literacy. They must know their treatment. They must know like the side effect of the treatment, and then the social support is lacking. So if we give them the social support and psychological support.
What about the therapy itself? It hasn't changed much, has it, for many years?
It hasn't. So the standard treatment currently is nearly 2 years of treatment, and people have to come to the clinic every day to get their treatment, especially for the first 6 months. They have to have an injection. They take an average of 25 different pills. All of them have really severe, horrible side effects. So it's just a really difficult regimen to stick to. So what we really want is shorter regimens,
yes,
much more tolerable, much more effective, that people are able to take easily.
What are you both doing about that? You're both working in Médecins Sans Frontières now. What are you doing about getting different regimens, different drugs, and improving the support that you were talking about, Busi?
I think for me, on the side of the support, really, it's good that you understand the level of the patient, you talk the same language. And for me, I can say thanks God with the drug-resistant TB, because I know how and the way they are feeling. So it's easy for me to interact with them, because I do understand what they are experiencing, what they are going through. So I can meet them in that level, and I'm also facilitating on the support groups, so that it's whereby they can voice up and come with their ideas themselves, really, to fight the stigma around the drug-resistant TB.
And Busi was really instrumental in developing a very structured counselling model for us to use with our patients, but that other people can easily use. So maybe you want to tell them a little bit about that, Busi.
In our counseling model, we counsel our patient as soon as when they discover that they've got drug-resistant TB, whereby we give the information around drug-resistant TB, which is our first counseling session happening at the clinic, and then following a second counseling session. After a week from that first counseling session, we recap from the first one, and then the third one is whereby we are doing the home visit involving the family, because if we leave the family behind, really, because they are also the major to give the support to this patient, so that this patient might adhere and finish their treatment.
So you're putting more emphasis on the whole community and family support than even on the treatment itself?
Yes, because firstly, really, we have to empower the community, and we need really to not perceive the patient and the community. We need to engage with them, so that we can come up with a really good support.
Presumably, though, there are all sorts of worries that people have legitimately about getting involved with medical treatments. Some of them might be cost, but others might be simply not understanding or not trusting the systems. What do you think about that, both of you?
So I think in Kailicha, we've certainly seen that over the years, through a lot of advocacy efforts and community mobilization efforts, we've really tried to raise awareness of drug-resistant TB. Busi's on a radio show, we do a lot of outreach programs to try and encourage people to come forward and test, to get them onto treatment, and then to say, make sure that people complete their treatment, so that we don't contribute to ongoing transmission of the disease.
What sort of hope and good news, then, might you have at this point? Is it still desperate?
So I think some of the good news that we've kind of seen over the past year or two is the emergence of new drugs. So really getting better drugs in better regimens is what we're looking forward to. And in Kailicha, we've been able to advocate to access drugs like linezolid, which are already existing but have been quite expensive for most people to access, and also new emerging drugs such as bedaquiline. And we've found out at this conference that we're able to access it for MDR patients in South Africa.
And Busi, I know you're dealing with not just drug-resistant TB, but what's called extremely drug-resistant TB. What is it, first of all, and how do you approach that?
I think it's whereby you've got a extremely really disease, whereby there are few options for you to get a really working treatment regimen.
And what hopes can you give people?
The hopes to give to people really is that for me it will be better if we can improve the decentralization, so that the patient can't go and seek the help, the help must come really to the patient.
Right, so what do you think about this, the move away from going to the big hospital far away from where you live?
I think it's been encouraging what we've seen in Kalycha, firstly with MDR patients a few years ago, and now more and more with XDR patients, that people are not necessarily, with extreme drug resistance, are not necessarily that sick that they need to be in hospital. They want their treatment, they will come to clinic to take their treatment, we just need to provide it to them.
Well, what very simple messages could both of you give from your experience, your very considerable experience on the clinical side, on the patient side? What messages could you give of hope and reassurance and, in fact, encouragement for people to do things the right way?
If we can, firstly, we can respect those patients who are having a drug-resistant TB and then treat them as the human beings and, not treat them as the disease. Really, it will be good and be better for me and for them, really, at the end of the day.
Yeah.
I think from my side, to say it's possible to treat and cure drug-resistant TB if you have the right drugs and the right support, and it's possible to do it in the community closer to where people live.
And a final bottom word, take-home message from each of you, people to remember?
I can say, as you can see my t-shirt, extremely drug-resistant TB needs extreme commitment.
And I would say we definitely need to keep looking for better drugs, better regimens, so that we can treat drug-resistant TB just as we do normal drug-sensitive TB.
And of course, learning how to use them.
Absolutely.
Thank you both very much indeed.
You're welcome.
Thanks.